Hi everybody, this is Dr. Kevin Smith. Thank you very much for checking out this video. Today we're going to talk about why most people suffer with low thyroid symptoms, a condition also known as hypothyroidism. Hypo meaning low and thyroidism affecting the thyroid gland or the thyroid physiology. Thyroid symptoms include such things as low energy, brain fog, weight gain, the inability to lose weight even with diet and exercise, the thinning of the hair, the loss of the outer one-third of the eyebrows, gastrointestinal problems such as intermittent constipation and diarrhea, and other types of thyroid-related symptoms, which you can check out more extensively on our website, www.integratedmetabolic.com. Now, most people that have these types of problems, when they visit their medical doctor, either primary care or their medical endocrinologist, these doctors will order typically a set of lab tests that are blood tests, and they generally will check for TSH, or thyroid stimulating hormone, and T4, which is thyroxine. And based on the results of these lab tests, the doctors may prescribe hormone replacement therapy, which comes in the form of either artificial T4, such as levothyroxine, one of the brand names would be Synthroid, or artificial T3 and T4, which is called Cytomel, or they may even prescribe natural desiccated bovine glandular, which comes in the form of Armour, which is a natural T3 and T4. Now, this is the standard medical treatment. This has been in place for over 50 years. And despite all of that, most people fail to achieve recovery from their symptoms. Most people continue to suffer with these low thyroid symptoms despite the medical doctors putting them on the meds and playing around with their dosage up and down. Now, some people do achieve a resolution, but in most cases they don't. Now, in the United States, the number one reason why people suffer with low thyroid symptoms is due to a condition called Hashimoto's autoimmune thyroiditis. Outside of the United States, the majority of the people that suffer with these types of problems, it's due to an iodine deficiency. We don't have that problem in the United States, primarily because we put iodized salt on almost all of our food. So we don't have a deficiency of iodine. This is a problem called Hashimoto's autoimmune thyroiditis, or Hashimoto's autoimmune thyroid. According to the current scientific research, 70 to 90% of the people that suffer with low thyroid symptoms have this condition. So what is it? What causes Hashimoto's? It is an autoimmune disease. And with autoimmune diseases, what's going on is that your immune system, which is your white blood cells, literally starts to attack your own body cells, mistakenly believing them to be an invading pathogen. And once that starts, it cannot stop. So once this situation starts, there's no turning the off switch. It cannot be shut off. Now, what we can do is apply sort of a dimmer switch and tone it down by removing the extraneous causes of what triggers Hashimoto's issues. Also, with 25% of people that are diagnosed with an autoimmune condition, 25% of these people will go on to have an autoimmune attack in other parts of the body, such as the stomach or the pancreas or the synovial joints or somewhere else. And so that's an increased risk factor. So what ultimately can cause Hashimoto's? Well, there's a lot of different reasons why people have this problem. One is genetics. There is a genetic link that goes on with this. Certain foods, certain exposure to foods and things in our foods, like gluten exposure is a very big one. Things in our environment and plasticizers, insecticides, pesticides, other types of toxins in the environment may trigger an autoimmune cascade in your body. Your gender will play a role. Hashimoto's autoimmune disease affects women 10 times more than men. Your age plays a factor. This condition generally affects adults over the age of 30. You don't really see a whole lot of this in children. And also there's a common problem with chronic inflammation that can play a role with this. chronic inflammation. We'll have a whole bunch of videos discussing what that is and what causes chronic inflammation. One of the problems with Hashimoto's is that it's painless. You don't know that you have this problem because you can't feel it. And you can't feel it starting and you can't feel it forming. And then after a while, what goes on is that the immune system, the white blood cells start attacking the thyroid gland, destroying the thyroid gland, and then over a period of time, you lose your function, and then you start noticing your symptoms downstream. But when you first start noticing your symptoms, that's not when your problem started. That's only when the symptoms started. The problem started a long, long time ago. So this could take years or maybe even a decade or so for it to fully manifest itself. Now, how is Hashimoto's autoimmune thyroiditis diagnosed? It's very simple. There's a very simple blood test. It requires 1 vial of blood. And what we do is we order a couple of tests checking for TPO and anti-thyroid globulin antibodies. And these markers will show up either positive or negative. Those are the only 2 possible choices. If it exceeds the lab range in one or both, TPO and anti-thyroid globulin antibodies, then it's positive for Hashimoto's and that has to be addressed. Autoimmune disease trumps literally everything else. And there's a lot of other reasons why people have low thyroid problems, but autoimmune disease is the #1 most common and the most destructive, and it has to be addressed and handled correctly. Now, one of the questions you may be asking yourself is, well, why doesn't my medical doctor order these tests? Well, they're aware of them, but most of the time they don't order them. And the simple reason is because it doesn't really affect their treatment plan. Again, the medical approach to fixing or addressing these problems is to put you on a hormone replacement therapy to get your lab numbers normal and also to get rid of your symptoms, but it doesn't really truly go after the root cause of the problem. The root cause of the problem could be due to genetic issues, or it could be due to environmental or dietary problems. It could be due to blood sugar dysregulation, all kinds of other issues that they don't really focus on too much because that's not their standard of care. I hope you enjoyed this video. I hope you learned something from it. And if you have any questions, please feel free to visit our website at www.integratedmetabolic.com. There's a link there if you want to ask me any questions. Just feel free to click on the contact information button and send me an email. I'll be happy to respond to them. I would encourage you to subscribe to my YouTube channel and please tell a friend. So thank you very much for tuning in, and stay tuned for more videos on thyroid problems.